time slot, so we will be sharing. Thanks, Aoife. So we will be sharing this recording after the session, along with the orientation deck and a more substantive guidance document. So all of these will be resources to you as you participate in the peer review process. So welcome again. My name is Dominique LaForest. I'm the portfolio manager for the STARS in Global Health program at Grand Challenges Canada. And we at Grand Challenges Canada have the great privilege of being one of the CIP Ghana partners. And so the CIP Ghana, as you likely already know, is being led by the Ghana Health Service. And is being implemented in collaboration with USAID, the USAID mission in Ghana, as well as USAID's Center for Innovation and Impact, and also our colleagues at AMP Health. And we have Chioma on the line, who I'm sure many of you know. And Chioma, I'll pass it over to you for a few words of welcome for our peer reviewers.
Hello, peer reviewers, welcome. I am Chioma. I'm embedded within Ghana Health Service, even though I work for AMP Health. I can see Dr. Nee Nkandu, welcome, and Dr. Nsia Boateng, welcome. So thank you for being part of us today. So over to you, Dominic.
Wonderful. Thank you, Chioma. So I think we can go ahead and get started. And Aoife, you can hit the next slide, please. So today we're just going to walk through, or I'll first walk you through the agenda. So we're going to touch on first, what is the Country Innovation Ghana pilot? Who are the CIP Ghana partners? What were the request for proposal areas of focus and the key funding details? What is the peer review? What to expect as a reviewer? Some reminders and tips. And then we're going to walk you through how to use the Flux portal. So that's where you will be conducting your reviews. And then we'll be making some notes about some reviewer support options available to you. And then we'll open up for a question and answer period so that you can hit on anything we might have missed as we walked through this. All right, Aoife, you can hit the next slide for me, please. Great. So the Ghana Health Service, in collaboration with USAID, Grand Challenges Canada, AMP Health, and other collaborators across the health ecosystem, have launched a country innovation platform in Ghana to identify health challenges that could benefit from innovation and support local innovators who can respond. The CIP Ghana seeks to contribute to the Ghanaian health ecosystem by testing innovative solutions that have potential to improve health outcomes, generating lessons learned about how to design an innovation process that is tailored to locally defined needs, and demonstrating the feasibility of a platform for countries to support innovations and invest in an ecosystem of informed and connected local health innovators. Over the past few decades, Ghana has made considerable progress in reducing maternal and newborn mortality. However, the country still faces many challenges in ensuring that mothers and newborns receive high-quality health services. In an effort to meet their goals, Ghana Health Services, with the buy-in of the CIP Ghana partners, determined that an appropriate investment area for this CIP pilot round would be maternal and newborn health. Supported by its partners, the CIP Ghana engaged stakeholders in a human-centered design process to further define this call for innovation. Stakeholders from across the country, representing diverse groups within the health ecosystem, were brought together in February of 2023 to participate in a 3-day co-creation workshop that served to identify health challenges in maternal and newborn health that could benefit from innovation and become the focus of this CIP pilot. Next slide, please. In this CIP pilot in Ghana, each of the 3 core CIP partners plays a unique and complementary role within the collaborative model. Ghana Health Service is leading this partnership. They identified the primary health challenges to be addressed, facilitated a co-creation workshop with partners across the Ghanaian health ecosystem, and will continue to provide guidance and oversight throughout the rest of the cycle. USAID's Ghana mission and their Center for Innovation and Impact developed the CIP initiative and have been essential in supporting the design and launch of this Ghana pilot. Grand Challenges Canada is providing the grant funding for this pilot and will be contributing its experience and resources to support the partners, applicants, and eventually innovators through the funding cycle. Finally, AMP Health has embedded a management partner, that would be Chioma, within the Ghana Health Service to act as the in-country coordinator of the CIP Ghana and help bolster the broader innovation ecosystem in the country. Next slide, please. So, what are the areas of interest and focus for this request for proposals? Through this funding call, the CIP Ghana partners sought bold ideas to support Ghana's ambition to increase access to quality maternal and newborn health services. This will support Ghana's ultimate goal of reducing maternal, perinatal, and neonatal morbidities and mortalities, reducing direct obstetric case fatality rates, and reducing the rate of stillbirth. These innovative solutions are expected to address key challenges in the accessibility and delivery of maternal newborn health services at the sub-district level within the networks of practice in 6 regions in Ghana. That would be the Western, Upper East, Upper West, Northeast, Northern, and Savannah regions. Overall, the CIP Ghana partners seek transformative ideas that lead to at least one of the following 4 priority outcome areas. First, improved communication and real-time tracking of information along the patient referral journey for mothers and newborns. Second, increased accessibility and availability of transport for pregnant women and mothers of newborns to reach health facilities, especially in emergencies. Third, improved skills of healthcare workers to deliver high-quality emergency maternal newborn health services. And fourth, increased availability of essential medicines and supplies for maternal newborn health where they are needed. Next slide, please. So a little bit more about the funding opportunity that was presented within this RFP. So each project will be awarded between 200 and 250,000 Canadian dollars. Project timelines are expected to cover 12 to 18-month periods. There will be approximately 10 proof of concept awards granted. Implementation must take place within the 6 target regions of the country. And target users are women, including pregnant women and mothers, children, adolescents, healthcare providers, and/or health facilities in communities within the target regions in Ghana who are unserved or underserved by current approaches. A little bit about what we will not fund through this request for proposal. In this CIP pilot in Ghana, the CIP Ghana partners will not fund projects establishing proof of concept of innovations for which the core intellectual property rights are owned by a third-party institution, unless that third party either grants the applicant sufficient license rights to the innovation to permit eventual scaling in low and middle income countries, or signs an undertaking to comply with Grand Challenges Canada's sharing and access for impact strategy. We will not fund projects similar to ones that the partners have previously funded. And Grand Challenges Canada has a searchable database on our website of funded innovations if you're keen to explore that a little bit more. We will also not fund projects implementing outside the 6 regions of focus for the CIP Ghana, or projects that are focused strictly on capacity building or advocacy and do not involve the testing of an innovative proof of concept. Over to you, Aoife.
Thanks, Dom. The CIP Ghana proposal review process will follow GCC standards 3 stages. The first one, eligibility screen. The second stage is innovation screen, and the third is peer review. Grand Challenges Canada is taking a leadership role in managing this process in collaboration with GHS and the other CIP Ghana partners. The results of each stage will be shared with the CIP Ghana partners for approval, deferring to GHS decisions. Eligibility screen. The CIP Ghana partners screened applications on the basis of the eligibility criteria outlined in the RFP. Applications that did not meet eligibility criteria were eliminated at this stage. All applications that are deemed eligible then move forward to the innovation screen stage, and reviewers at this stage included staff from all CIP partners, organizations, and their affiliates. Those applications that were deemed relevant and received top scores at the innovation stage have now moved through to the external peer review stage. This is the stage that you're all participating in. At the peer review stage, applications will be reviewed by a panel of 3 expert peer reviewers with deeply relevant scientific or technological, social, and business or sustainability acumen. In this final review stage, full applications will be scored against a more comprehensive set of evaluation criteria. Given the goal of the review stage is to assess the complete application, as well as the comprehensive criteria being scored, the CIP Ghana partners, led by GHS, have identified peer reviewers who bring a level of expertise to the review process that has not been drawn upon in the earlier stages. It's at this stage where we expect to surface the truly innovative and promising ideas that will ultimately become recommended for funding. Following this review stage, the top-ranked applications with fundable average scores will be recommended for funding. The CIP Ghana partners may seek to select within the fundable list a more balanced set of projects based on priority outcome areas and or region of implementation. And I'll pass over to Tom.
Thanks, Aoife. So we just wanted to quickly highlight here what types of reviews we saw. So we received a total of 135 applications that were ultimately submitted. The vast majority of those were coming from institutions based in Ghana, which is unsurprising, but a good smattering of institutions from across the rest of the continent. In terms of addressing priority areas, we saw a pretty good spread across the 4 priority areas, with the most applications coming in around the improved communication and real-time tracking information along the patient referral journey. In terms of implementation region, again, we saw a pretty decent spread. We asked folks to select at least their first to select at least 2 priority areas, but up to 4 priority areas, and then rank them in order of priority. And the reason we asked folks to identify at least 2 is because there will be an expectation for these innovators to implement in at least 2 different regions. And when we come to the selection stage, the Ghana Health Service team that is assessing these results will actually determine where projects are to be implemented, and they will try to adhere as much as possible to implementation in their top priority regions. But of course, there may need to be some reallocation to ensure disbursement of implementation across the 6 regions. All right, and in the next slide, I have no results yet of, you can flip to the next slide, Aoife, but we don't have the results yet to share about the innovation screen, which has been completed. We are just in the final stages of addressing re-reviews for a few outlier scores and waiting on a discussion we are going to have with our colleagues at GHS about the results. So once we have those results, which we should land on later today, we will fill in this slide to provide an overview of what those look like, and then to give you an idea of what will be coming to the peer review stage. So by the time we share this deck with you after this, along with the recording and the guidance document, we will have those results input for you.
Thanks, Tom. As mentioned, the eligibility screen has now been completed. Eligible applicants include those that are legally incorporated in an eligible country. These include North, West, East, Central, and Southern Africa, as well as Canada. Canadian applicants must identify a confirmed Ghanaian collaboration institution, not a public sector entity, in the proposal. Proposals that provide all required information, all applications, questions addressed, submitted via Flux, etc. Applications submitted in English or French. Proposals where a majority of the application's activities and budget must be carried out or spent in 2 approved regions of focus, Ghana. Applications with a listed project lead who is affiliated with the applicant organization. Proposals by a unique project lead, i.e. project leads can only be listed on one application. Additionally, the innovation screen has just recently been completed. During this stage, proposals were assessed by 3 reviewers. As previously mentioned, reviewers included staff from all CIP Ghana partner organizations and their affiliates. It's important to note that the purpose of the innovation screen is to screen out proposals that are a weak fit with the call, not a selection of the best. At this stage, we asked that the reviewers evaluate the proposed idea only for its innovativeness and relevance to the RFP, and not the feasibility or the quality of the project plan. The relevance criteria used a simple yes/no binary scoring. The innovation criteria used a ranked score from 1 to 10. Reviewers were provided with a scoring guidance to reference in order to ensure consistency in the scoring. Only applications deemed relevant and receiving a top-ranked average innovation score are pushed forward to the innovation screen, from the innovation screen to the external peer review. Given that the CIP Ghana partners aim to award 10 seed grants through this funding round, we anticipate moving through approximately 30 proposals to the external peer review stage. At this stage, all applications will be reviewed by 3 expert peer reviewers. In this final review stage, full applications will be scored against a more comprehensive set of evaluation criteria. The average score of each application will then be plotted on a ranked list of applications. It's expected that the top ranked applications with a fundable average score of 3.5 or greater will be presented to the CIP Ghana partners, led by GHS, for funding consideration. The CIP partners may seek to select within the fundable list a more balanced set of projects based on priority outcome areas, implementation, geography, or other key criteria. As previously indicated, at the peer review stage, each full application is reviewed by 3 independent peer reviewers with relevant scientific, social, and business expertise, including GCC innovators, past and/or present. Reviewers are to use the following evaluation criteria for their assessments: impact, innovation, project evaluation plan, leadership and team capacity, and value for effort. Reviewers are asked to provide scores for each criteria category and given comments to justify their scores. A final score will be automatically calculated based on the different weight each category has, as shown on this slide. To better define the evaluation criteria, we listed a few sub-criteria questions under each category. These questions should serve as your reference and reminder when scoring applications and providing comments. Apologies for this text-heavy slide. There's a full set of criteria. Review criteria will be outlined in the guidance document that we'll share for your reference. So I won't go through all of this. Reviewers are asked to give scores to 1 decimal point between 0.0 to 4.9. Only projects with an average score of 3.5 plus are considered fundable. And to justify your scores, we ask you to provide a brief comment on each of the evaluation criteria categories. The comment should only address aspects of the criteria listed above. And we ask you to provide thoughtful feedback, as your comments will be shared with the applicants. So please ensure you use appropriate professional language. Our definition of innovation includes testing of existing ideas or approaches in new context. Innovative approaches to implementing and delivering known interventions are encouraged. Please also keep in mind that English may not be the first primary language of some applicants, so spelling and grammar are not being judged in this review, only the proposed innovation itself. Please focus on the main ideas being presented in the application rather than how they're communicated. While we encourage innovations that take an integrated approach, projects do not necessarily need to address all 3 aspects of integrated innovation: social, business, scientific, or technological. Projects may only demonstrate innovation in one of the 3 areas. These are proof of concept proposals, and we do not expect that all aspects of scale and sustainability have been fully addressed. The purpose of this funding is to test ideas that have a potential to fundamentally transform the space. Now some reminders and tips with regards to the reviews and providing feedback. We encourage you to read through a few proposals before submitting your scores. We also recommend working through proposals in batches of 2 to 3. And finally, we definitely suggest we try to space out your work across the 4-week period. And now some tips and reminders for providing your written feedback, which will be shared with applicants without scores. So only comment on aspects of the proposal relevant to the evaluation criteria. Provide 2 to 3 sentences for each criteria category, including the overall comment field. Be concise and constructive. Use appropriate and professional language. Do not write scores in the comment boxes. Do not mention or discuss other applications in the comment boxes, and avoid using I statements. So I will give you a quick run through of the Flux portal now and what you'll see when you sign into it. I'm just going to stop sharing. Can you see that? Can everybody see that?
Yep.
Okay, great.
It's coming up well.
So when you sign in, sorry, that shouldn't pop up. You will see, oh, sorry, you will see your reviews that have been assigned to you here. There'll be a list of them. You'll see assigned reviews. So once you click into it, the first thing you have to do is acknowledge that you have no conflict of interest, which hopefully you can tell by the name of the organization should be listed here, and you should see the project lead as well. So if you've no conflict of interest, you acknowledge that, click that button, and once you hit save, it should pop up on the left. So you'll get the whole application. Sorry, this is a different application, but if you scroll down, then you'll see all the information that you need to fill out yours. And then here's the scoring page. So it will ask all the questions and give you the boxes to write your answers in. And then once you're done, you hit save. And if you want to do a couple first, hit save, and then you can come back to them and hit submit later on. Right. Just going to go back to the presentation. Okay. So yeah, we went through that login as a reviewer. You'll see the list. You declare no conflict of interest, and then you can fill in your form. And Madas will open it up for questions.
Thank you so much, Aoife. And thank you to our reviewers for joining us. There's only a few of you on the line right now. I imagine the majority of people will be listening to the recording, but please feel free to just come off mute and jump in with any questions you may have.
Hello, thanks for the presentation. Can we hear? Did I miss the setting up for Flux, or is that coming up soon?
So when you registered in Condu, because I believe we received your registration, and so when you signed up to be a peer reviewer, so I believe that should have been set up already. But Aoife, perhaps we can just double check and follow up with Condu, because you should have received, if you were set up on Flux, and Aoife, correct me if I'm wrong, but you should have received an email notification with a link to log in. Aoife?
No, we don't set out
Oh,
until we send all this information, because we don't really want anybody logging in before.
gotcha.
But, so yeah, I will have set you up, and then when I send out the recording of this and the instruction guidance, you will also receive a link to Flux, and you just log in with your email address. It will ask you to change your password, and then you should see everything there.
So it should be a relatively painless process. But if you have any issues accessing the platform, just reach out to Aoife, and she's usually very quick to provide a solution for you.
Got it. Thanks.
Eric, Nee, any questions from either of you?
I think at this moment I'm fine. The presentation was clear. We look forward to receiving those documents and the link to register for the peer review. I think one thing I was asking myself was like how the regions that we've mentioned in the presentation were selected. And I think I could also answer it myself because I'm in charge of the MNE for the sector. So I know that when you do the regional disaggregation with respect to maternal and newborn health services, those regions are lagging behind. So that might have informed the selection of these regions for this innovation intervention. But if there's any other reason apart from this, I'll be glad to hear. Thank you, and over.
Thank you so much. So yes, that was one of the big leading reasons why these regions were selected. And the regions were selected through discussions between the USAID Ghana mission and our colleagues that we're working closely with at the Ghana Health Service PMD division, the Planning, Monitoring, and Evaluation division. So obviously the maternal newborn health outcomes was a primary leader. Also, these regions are going to be part of, as you may know, the initial rollout of the networks of practice. And so because GHS is wanting to have these interventions implemented within the networks of practice, they were wanting to target regions where these networks of practice were going to be rolled out soonest. So those were the primary reasons that were shared for their selection.
Thank you very much.
No problem. Nee, over to you. Any questions from your end?
Hi. I'm okay. I think significantly, I just need to know the timelines that we are looking at starting it, and then possibly how many proposals will be assigned to each reviewer. I see from the notes that we're looking at, but you didn't really state how many specifically, but you said the total number exceeded the 30 that was planned for. So I guess we may need to plan carefully how we'll use our time. Thank you.
Thank you so much, Nee. Excellent questions, of course. So the goal is for all of the reviews to be assigned by Friday, and then for you to have access as of Friday. And then the deadline to submit the reviews will be November 5th. So approximately a month to get all of these reviews done. Our expectation is that the majority of reviewers will have we'll have around 8 reviews assigned to them, and we're estimating that reviews take about an hour each, so that you have sufficient time to actually do a thorough review of the proposal and then provide thoughtful feedback. So about an hour per review is kind of what we suggest for folks to expect to spend. And we're assigning numbers of reviews when you would have registered to be a peer reviewer. One of the questions would be about how much time you can commit. And so we're trying to assign on the low end of what your commitment range would have been, just to make sure that this is feasible. We were very fortunate that Dr. Alberta led the charge in nominating quite a number of reviewers. And so there are, I think, about 30 of you. So we're really able to distribute the reviews quite well. So yeah, I would expect probably about 8, I think, is the average that I'm seeing. But it might be a little bit less, it might be a little bit more, depending on what your time commitment was. You should see the full number of reviews as of Friday. And if something changes in terms of your availability and capacity to take these on, we just ask that you reach out to us as soon as possible so that IFA can reach out to other reviewers to see if they can take on any of the reviews you might not be able to complete because of whatever changes may occur within these next 4 weeks.
Okay, so can I follow up with another question
Of
about
course.
that? Yeah, how many reviewers are expected to look at each proposal? So I guess there'll be a primary reviewer and there might be a secondary reviewer, or we'll have about 2 or 3 reviewers equally reviewing, and then the result to be a decision of the majority. So
Yes, thank you. So there will be 3 reviewers on each proposal. And so we've roughly categorized the reviewers into sort of 3 categories. Those with significant technical expertise, so in the area of maternal newborn child health, those with sort of the social expertise who really understand the context in which these innovations will be implemented. So specifically those with expertise in the 6 target regions. And then those with more of a business sustainability innovation perspective. And so there will be one of each of these categories of reviewers assigned to each proposal. And the goal there is to ensure that we have different perspectives being brought to the reviews to sort of balance things out. And then the ultimate score will be an average of the 3 scores, the 3 final scores that each of those reviewers provides.
all right, that's understandable. Thank you.
No problem. And then maybe just to add on to that, once we have the final total average scores, those scores will then be plotted on a ranked list. And typically, we select, the top ranked proposals for funding. But of course, in this case, the GHS team might decide they would like to achieve a little bit more balance between, proposals that are targeting the different areas, priority outcome areas, or a balance in the regions being targeted. So long as a proposal hits over an average score of 3.5, which is considered fundable, then there's flexibility in all of those proposals that sit above. So if we're, looking to fund 10 proposals, for instance, and there are 25 that sit above the total average score of 3.5, then GHS has a lot to work with and can make decisions, and will document those decisions and why those choices are being made. Great. Well, that brings us to the end of this presentation. You'll see on the slide in front of you that IFA will be holding weekly office hours throughout the review period. These are drop-in. If you have questions, you can come in and pose them. If you need help working through the Flux system, she can assist you with that. If you're not able to make those office hours, no problem. IFA and I will always be available via email, and we're pretty quick to respond. So, and if you need a particularly urgent response, just make note of that in the subject line, and we are available to assist throughout the period. With that, if there are no other questions, I think we can close out. And really just wanted to again acknowledge and appreciate your commitment to this process. We're so grateful to have the expertise of all the reviewers who have committed time to this process, and look forward to seeing what comes out of this at the end. All right, I think we can end the recording, Aoife.